Hey guys, today I will be doing a review on Invisalign, which I have on right now. This video will explain what you need to know, the expenses involved, and also the rules that you should follow when wearing it. Okay, so to start off with, I'll explain what Invisalign is. Invisalign is your alternative option from wearing traditional braces, which are, the typical, as you could say, train tracks. As for Invisalign, instead of having metal on, how it strengthens your teeth is by wearing these clear trays in your mouth. And depending on your treatment, you'll get a certain amount of trays. For my treatment, I got a total of 24 upper and lower trays. And I'll show you how these trays look like right now. I have it on, so excuse me. Well, it looks like this. Clear, and it's very form-fitting to your teeth. And what the dentist does before receiving Invisalign is that they attach what they call attachments onto your teeth, like around your canine basically, and your lower teeth as well on certain areas to help anchor your trays, so it wouldn't move around. At least that's what I was told. And you can't exactly see my attachments if I were to try to show you right now because of the lighting. So I would explain them as half the size of a piece of rice sticking out on your teeth. It's just not obvious. And each tray you're supposed to wear it for about 2 weeks, and after 2 weeks you move on to your next tray. And as you switch trays, it'll gradually and very, very slowly move your teeth. Okay, I'll start off by explaining the expenses involved. My treatment costed a total of $3,333 just for the Invisalign itself. I think that's actually a lot cheaper compared to a lot of other people's treatments, I've heard at least. But I actually had extra work done, and what I needed was for my teeth to be slenderized. It basically files down your teeth using this very thin metal. It looks like a chainsaw, but a miniature size one for dentists basically. And it doesn't hurt at all. You don't feel much, honestly, and I have really sensitive teeth, but I was really afraid to start off with though. So that treatment was only 30 minutes long just to have my teeth slenderized. And I actually needed my teeth to be slenderized because my bottom teeth right here was overcrowded, and rather than actually having to extract the tooth off, I just basically shaved a little bit off. So for that treatment alone, it costed me $600. So basically for my trays and to slenderize my teeth, it was a total of nearly $4,000. Yeah, that's a lot of money still. And when you're a patient of Invisalign, you should be aware to not lose your trays, because each tray that you lose, for me personally, costed an additional $150. So if you lose top and bottom, that's an additional $300 that you would have to pay on top of your treatment already. The bright side of Invisalign is that your treatment normally doesn't take too long. For me personally, I could have had it done in about 1 year. However, it's been 1.5 years so far. I still have it on, and the reason why it took a lot longer than what I should have is because each tray you're supposed to wear it for 2 weeks and 22 hours per day. So every time I wore it, and when I would take it off, I would forget to put it back on. And when I did forget, it would sometimes last from 1 to 2 days, sometimes, if not half a day. And so for every 1 to 2 days or half a day that I would miss, I would have to add on to my 2 weeks. And so 2 weeks would become 3 weeks, 3 weeks would become 4 weeks, and you get the picture. So that's why it took me half a year longer. I think I'll be done this summer though. I'm pretty dedicated so far. I don't want to drag it any longer. I needed Invisalign because I actually had an overbite, and my bottom teeth was really, really, really crowded. It was just like a tornado went in there and just shook everything up. The most important rule about wearing Invisalign is that every time you eat, you have to take off your braces and put it aside. After eating your food, you should brush your teeth before putting it back on. The reason for this is because when you're eating, food gets trapped in your teeth. And if you were to just put the braces back on, you are entrapping the food into your teeth while there isn't really much saliva circulating around. As you know, saliva naturally has some type of cleaning agent. You're capable of developing cavities, plaque, and I don't know what else. When it comes to eating, you could eat with it on, which I've tried because I didn't feel like taking it off. It's not a good experience. It actually makes the food less enjoyable. It's kind of weird, to tell you the truth. Would it be comparable to maybe walking in mud while not wearing shoes, but rather a trash bag? Yeah, it's kind of weird. Not only that, if you were to actually eat with it on, it's likely that food will get trapped inside your braces, which has happened to me many times without me knowing. In fact, I would be in class just eating my chips or my Cheez-Its, and as I'm eating it, I'm just enjoying it, like, oh yes, this is so good. But when class is over, I'll walk to the restroom and I'll smile and I'll see these yellow bits of crumbs and things in my teeth that's been entrapped, and I didn't know all along while I was talking to my friends and they didn't even tell me. When I first got Invisalign, I wasn't really used to it at first. It was actually kind of a weird feeling because for all day long you would have this tight feeling in your mouth. In fact, Invisalign doesn't hurt at all. It's not like your typical traditional braces where you get tightened and your teeth is all sore. Not sore, but really painful when shifting. Rather, when wearing Invisalign, your teeth is just only a little bit sore. It just feels slightly tight. You could still eat, you could go on with your day, you would not be in pain. That's the bright side of it, and that's what I really like. When it comes to brushing your teeth in the morning and at night, you should also brush your braces as well, because if you don't, let me tell you something, it smells, it stinks. Luckily, the person you're talking to or your friends, they wouldn't be able to smell it. However, when you're taking it off and it's right in front of your face, you can smell it right away. Another thing about Invisalign is that when I first got it, I actually found it kind of hard for me to take it off and put it back on. The dentist showed me that you should actually be pulling it from the outside and snapping it off like that. However, I thought it was a lot easier when you would, this is a pretty good tip, when you would actually pull it from the inside like this. So after I pulled it down, sorry, that happens a lot when you take it out. Saliva is likely to be connected to your trays. But yeah, that's an easier way. Instead of pulling it from the outside, you pull it from the inside to pop it off. And then after that, you just take it right off. It's really easy. And that goes the same for the bottom trays as well. And this is how you put it back on. It's really simple. Just like that. There isn't much difference from me wearing braces and not wearing braces, because since I actually have the option of being able to take it off, I don't feel like I really am wearing braces most of the time. And oh, the downfall about any type of braces basically is that sometimes when I speak, I would have a lisp, and it'll be kind of embarrassing at times, especially when I'm talking in front of a class or talking to my friends and I catch myself doing that, and they wouldn't know because my trays are clear, so they wouldn't know it's caused by my braces. Oh, not only that, depending what type of lipstick or texture of lipstick that you're wearing, it could sometimes rub off onto your braces. I noticed that for me, when I would wear pink buttery lipstick, it would kind of like smear onto my trays, and it's more of like a sheer color on your trays, but it's not that attractive though. It's not obvious enough, but it does look like there's some type of like discolored tint on your teeth, which is not very pretty. So I said earlier, the rules of Invisalign is that you should brush your teeth before putting your trays back on after eating, and also, most importantly, don't lose your trays, because that just only costs you even more money. And what happened to me, unfortunately, because I lost so many of my trays, is that instead of purchasing new trays, I started skipping trays. So let's say I was wearing tray 15, and suddenly I was eating at a restaurant, and I left it on the table and I just walked off. So instead of me ordering new ones, I just skipped to tray 16, and 16 wouldn't be a good fitting because for tray 15 I didn't wear it for the full 2 weeks, and so when I would wear tray 16, it would be really tight, and the tighter it is, the more painful it is. I know that sounds wrong. So I wore tray 16, and then the next day I would lose tray 16. Yeah, I lost it the very next day. So I would have to skip to tray 17. So now I basically skipped 2 whole trays already, and my teeth would be really tight. That's just only one of my experiences that I'm explaining to you. I skipped trays several times within my treatment. So my teeth has been really strained, and it's been through a lot considering that I'm wearing Invisalign and it shouldn't be undergoing so much pain. Okay, so one day, after skipping so many trays, I was eating at a Korean barbecue spot, and my friend, he noticed that one of my tooth, my bunny tooth, this one right here, became discolored. And I freaked out. I didn't understand what he was talking about. When I looked at myself, it was turning into like a slight gray tone. And it was very sensitive to cold and hot food. It would just be in constant pain. And one day I went to the dentist not too long later, and they told me that I actually had a root canal. They asked if I had any trauma on that tooth. So I started thinking back, and I realized when I was a lot younger, I was playing sports, and so one day my friend, he accidentally threw a ball at my face, and I fell right towards the ground. So when I fell on the ground, I fell face front, and when that happened, I actually kind of chipped my tooth off, and I didn't notice this, but my tooth is actually cracked in the center. So when I explained that experience with him, he told me that it's been hanging on for many years, and it just gave up when I was eating one day. It's been really strained. So I just thought, like, what could have caused that? What could have caused that? And I realized because of the fact that I skipped so many trays and caused my teeth to be in so much pain, just pulling and pulling and pulling, my tooth gave up. So there was an infection going on, and the whole root canal process. I connected it to my Invisalign treatment and how I didn't follow the rules. I got a root canal job done, but even after getting it done, my tooth was very discolored. It was so obvious. It was just like a white teeth everywhere, then smacking gray tooth. It was so embarrassing, honestly. I was really embarrassed to smile. I would smile like this when our friends would be talking to me. Yeah, it was that bad. Until I found a doctor near Sunset. He performed internal bleaching on my tooth. He bleached it from the inside out. So as a warning, please just follow the rules of Invisalign. Brush your teeth if you don't want any cavities, and don't lose your trays. Even though from wearing Invisalign, it costed me a lot of unexpected expenses. Overall, I'm really happy I got it compared to traditional braces. I mean, it's clear, you can't tell that you have it on. A lot of my friends didn't even know I had it, in fact. And most importantly, it really did straighten my teeth. I really like my teeth now. I would highly recommend anyone else who would be qualified for Invisalign to get it, especially if you live in the LA area, because of the special promotional pricing that was offered to me. If you're interested in getting Invisalign yourself, and you happen to live around the LA area, and you want to go to where I got my braces done, you could go ahead and inbox me, and I'll message you the information about it along with their website and contact information. They're very professional, and it's a really nice office. In fact, the doctor that I had was highly recommended on the Invisalign site. The negativities that I told you were all caused by me personally because of my lack of keeping up with the treatment. Well, thank you for watching this video. I hope that this was really helpful to you. If you have any questions, go ahead and leave it on the comment box below. I'm sorry if this wasn't completely clear to you or if I rambled on too much, but I hope that this was helpful overall. Okay, thank you. Have a good night.